Hello everyone, welcome to this lecture, Experimental Study. The aim of experimental study is to confirm the hypothesis. We have studied descriptive studies, aim is to form the hypothesis, analytical study aim is to test the hypothesis. Now experimental study aim is to confirm the hypothesis. The types of study according to units of intervention can be three types. Clinical trial unit is individual patient. For example, testing a new drug. Field trial unit is a healthy individual. Example, vaccine trials. Community trial, the unit is a community. Example, fluoridation of water. Now, clinical trial, studies of new medical intervention to evaluate their effect on human health outcome. It can be drugs, it can be cells or other bioproducts, it can be surgical therapy or radiotherapy or medical devices, behavioral therapy, preventive care. Now there are 4 phases in clinical trial. Phase 1 trial, also called clinico-pharmacological studies. It can be done in healthy individual, generally less than 100 people. So to test the safety of the drug or the equipments or the therapy, we are going to do this. Phase 2 trial, clinical investigation with exact condition. That means with the deceased people we are going to do this, and population needed is 100 to 300. This is to check the efficacy, how is the overall function of that particular drug. Phase 3 trial is done by large scale RCTs, again with exact condition, same disease. Sample size is 1000 to 3000 or more. We can confirm the effect of that particular medicine, so comparison with the standard treatment. Phase 4 trial is called post marketing surveillance. It's done in the general public, so long term adverse events will be checked. Then registration of clinical trial. First we have to register an institutional ethical committee or independent ethic committee. For example, ICMR, we have to get approval, then we can register in clinical trial registry of India. So online we will be registering, we get one registration number so that we can start the study. Central Drug Standard Control Organization is there, so we need permission of CDSCO as well, only for trials related to drug, vaccine, therapy or medical device. This approval is not necessary for interventions like health education, lifestyle changes, risk modification. So the ethical considerations in the trials are informed consent. From all the people we need to take the written consent. If a child or mentally ill person is there, we need to take a assent and guardian consent. For assent, less than 7 years, no need. 7 to 12 year verbal assent is fine. 12 to 18 year written assent is needed. We will be explaining the purpose of study, procedures involved, risk and benefits of the studies, and they have right to withdraw from the study anytime. We may need to provide some compensation. Conflict of interest and privacy and confidentiality, respect for the participant, placebo use when there is effective treatment is there. Now type of experimental studies according to the allocation. It can be randomized controlled trial, non-randomized controlled trial. Types of RCTs: therapeutic trial with the drugs, preventive trial testing vaccines, risk factor trial. Example, Stanford 3 community study in US. Risk factors: low fat diet, exercise and smoking cessation were done, and then BP and serum cholesterol level were checked. Arelia project in Finland, lifestyle modification is done and BP and cholesterol level monitored for the improvement. And cessation experiment to stop the smoking, and we'll be evaluating the patient condition. Trial of etiological agent. Suspected factors are introduced. For example, oxygen in premature babies led to retrolental fibroplasia. Evaluation of health services, that's the other type of RCT. Now non-RCTs, uncontrolled trials. This is only to see the effect is there or not. For example, pap smear study. Is there any use of pap smears in the cervix cancer? Natural experiments, when any disaster happen, we take this as an opportunity for our study. For example, atomic bombing in Japan. So we'll be checking for the outcome. Before and after comparison study with the control. For example, seat belt legislation was conducted in Australia. Before this legislation and after this legislation, what is the rate of accidents checked with control. And then before and after comparison study without controls, there won't be any comparison groups, only one group, scurvy among sailors before introducing the fruit, after introducing the fruit. Now randomized control trial, drawing up a protocol, the title of the study, background, rationale of the study, study designs, about sample size, everything, randomization, what intervention we are going to use, how we are going to measure the outcome, everything will be making as a protocol. Then selection of the target population to whom the results are generalized. For example, elder females of Maharashtra. Selection of experimental or study population. Out of these females, whoever fits the eligibility criteria and who is willing to give consent, and according to the sample size, we are going to select the study population. Take as a 1 lakh female. Out of it, who fits in the eligibility criteria? Maybe 1000 females. Now randomization is a procedure by which participants are allocated into the study group and control group. Types of randomization: simple randomization, tossing the coin, taking the chits. The disadvantage is unequal distribution. Stratified randomization, according to homogeneous characteristics, we will be making a group: strata 1, strata 2, strata 3, strata 4. From each strata, we will be drawing the samples according to simple or block randomization methods. Now, cluster randomization. Naturally occurring clusters. For example, school A is a test group, B is a control group. Now, block randomization. We are going to divide the 4 to 6 people in a block. Like that, we will be making lot of blocks. Each block required number of samples drawn. An adaptive randomization, first simple randomization method, we are going to select the samples and then interim analysis is done. Based on the outcome of the study, participants with better outcome is reallocated. Now manipulation, that means intervention. We are going to apply the intervention here. And now follow up, periodic follow up is done and then variables are measured. Now comes analysis. The outcome can be death, disease or complication. For example, in the A group, 10 got fever out of 100. In the B group, 40 got fever out of 100. Next step is we are going to calculate the risk for each group. So risk for A group is 10 divided by 100 is equal to 0.1. B group, 40 by 100 is equal to 0.4. Now we are going to check the efficacy. Efficacy is reduction of risk. So risk in placebo minus risk in treatment group divided by risk in placebo group. 0.40 minus 0.10 divided by 0.40. We get 0.75. That is into 100 we can make 75%. So interpretation is treatment reduced fever occurrence 75% compared to placebo. Types of the RCTs, we have concurrent parallel study design, then we have crossover study design. Concurrent study design, patients randomized, intervention arm, control arm, and the outcome is measured. This is a simple normal randomized control trial. Now crossover study design, we have planned crossover and unplanned crossover. So patients again same randomized to intervention and control arm. So at the end we are going to measure the outcome. After a period of washout period, effects of that particular drug lost from that patient's body, again these people are reallocated. Control arm people to intervention arm, this intervention arm people to control arm. Then again outcome measured. Outcome of these drug is compared with the placebo outcome of same patient. Now unplanned crossover, patients are randomized, surgery only group and medical treatment group. Surgery only group, some people may refuse surgery, they want only medical treatment. That time unplanned crossover occur. Here some medical treatment suggested patient may progress into complications. So that time that patient must need a surgery. That time crossover occur. Then at the end outcome compared. Advantages of randomized control study. Good internal validity. So there are very much less bias how accurate the results are under strict conditions. Temporality established. Causality also established. Event or factor is the main reason for that disease. Disadvantage less external validity. How accurate the results are when applied into the external population on real world. RCTs mostly uses volunteers, so external validity is less. Bias, subject variation related to subject, related to observer, bias in evaluation, that is analyzer bias. So subject bias, investigator bias, analyzer bias. So this is controlled by single blinding. We won't be telling the patient which drug they're going to give. This is double blinding. Here we'll be blinding the subject and the investigator. Here triple blinding. So patient, investigator and analyzer doesn't know about the allocation. So we are at end of our study, experimental study. We have studied about the type of experimental studies, units of intervention like clinical trial, then field trial and community trial. Then stages of trials we have studied, and about RCTs and non RCTs. We are at the end of our lecture. Hope you understood the lecture, and thank you for listening.